What is sepsis? Sepsis is a life threatening medical emergency that takes place when your body has an extreme reaction to an infection. This reaction can lead to the damage of vital organs and cause death. In common, it is something known as blood poisoning. In general, your immune system fights an infection that you have contracted. But in some cases, it stops fighting the infection and triggers widespread inflammation in your body as well as blood clots. When this happens, blood flow to essential organs in your body is impaired, depriving them of nutrients and oxygen and causing damage. Sepsis usually occurs due to bacterial infections, but can also result from other infections, including those of virus, fungi, or parasites. There are some common types of and sites of infection that can lead to sepsis. These include infections of the lungs such as pneumonia or COVID-19, infections of urinary tract systems such as bladder or kidney infections, infections of the skin such as cellulitis, and infections of gastrointestinal system including those of gallbladder, liver, and bowel. According to WHO, anyone affected by an infection, severe injury, or serious non communicable disease can progress to sepsis. But vulnerable populations are at high risk. Older adults, pregnant or recent pregnant women, neonates, hospitalized patients, and those with weakened immunity system and chronic medical conditions. There are several symptoms of sepsis. These include feeling very cold, chills and fever, rapid heart rate or low blood pressure, shortness of breath, warm or clammy skin, confusion or delirium, and severe pain or discomfort. In children, the WHO says symptoms can include fast breathing, convulsion, pale skin, lethargy, difficulty waking up, and feeling cold to the touch. In children under 5 years, it can cause difficulty in feeding, frequent vomiting, or lack of urination. For people who have recently been in hospital, catheter sites and surgical wounds could become sites of infection. Sepsis can progress very quickly. It is important to seek medical help as soon as possible for diagnosis and treatment. The faster the treatment for sepsis is started, the more effective it is. Treatment generally include antibiotics and may include other medications such as vasopressors, IV fluids to maintain blood flow to the organs, oxygen if required, or other supportive care. Preventing an infection is the best way to help prevent sepsis. Maintaining good hygiene, including hand hygiene, keeping cuts and wounds clean and covered, keeping your immune system strong with well balanced diet and management of chronic conditions, and getting vaccinated on time are some ways that can help prevent infection.